By the time he went to the garage, like after a half hour, that's when that happened. And my mom called me and then I went down there. I want to stand up, but I can't. And then I tried to reach my phone to call my wife, but my phone dropped and I cannot reach.
You can give any stroke patient who's having the stroke due to the blood clot TPA. TPA is a medication, it's short for tissue plasminogen activator, and what it does is it breaks down the blood clot in the brain, and you have to give it within 4.5 hours of their last seen normal. So it's imperative that they get to the hospital quickly.
Llegando aquí al hospital, ya como que ya lo estaban esperando porque como él ya había hablado y la recepcionista, yo creo que sabía que íbamos a llegar porque rápido lo atendieron.
One of the ER physicians called me because they were concerned that you might be having symptoms due to a stroke. The Telestroke program can happen from anywhere. It can happen in our offices, it can happen in a Telestroke station that we've set up in the hospital itself, and it can happen in our cars. Mr. Jones, I'm going to ask you a couple quick questions. We're able to see patients remotely at every single Southern California Kaiser Permanente hospital.
We're not going to leave you alone.
The process is for their local emergency room to follow our code stroke protocols. And so we get called before the patient even gets to the CT scan. That allows us to hop on the computer, start our Movi, which is our two-way video audio system that we use to communicate with the patient and their family. Once they get to the examination room, we do a brief exam verifying the stroke symptoms, and then we go ahead and give the IV TPA. From them hitting the door to us actually starting the TPA can be as short as 25 minutes. I want you to close your eyes for me, tight as you can.
I can't move my left side. The sleep completed the sleep.
Okay.
I saw her on the screen. She said she was a specialist and she was one that knew what to do with these kind of situations.
Nos dijeron los doctores que se iba a quedar y le dije yo a él, te vas a quedar, Fernando. Le digo, no sé cuántos días vas a durar aquí, pero te vas a quedar.
The results are huge increases in the amount of IV TPA that's being administered throughout the region, going from basically 0 levels to 20, 30%.
Before Telestroke, only 15% of patients were getting TPA within 60 minutes. After Telestroke, the number jumped up to 54%.
The two next things we would like to do with Telestroke is Teleneuro ICU for management of intracranial hemorrhage and Telestroke for inpatient code strokes.
The doctors, when they've received a Telestroke page, they're logging onto the laptops immediately, and they're counting every minute that they have, and the Telestroke is giving them precious minutes back. And I think that's the greatest benefit of this.
The patients are very happy when they know that a specialist is going to see them right away. From even that far and remote, they are very appreciative, they are very thankful.
There was no delays. There was nothing backing us up. It was just like straightforward.
Y gracias a Dios, ahí está. Pero yo sí me preocupé porque nunca lo había mirado así.